Hello, my name is Rachelle Schultz and I'm the CEO at Winona Health. And this morning I'm going to just talk about one of the key issues that we've been getting a lot of questions about. We've just decided to do a couple of little video chats, if you will, or posting these online just to answer some of the key questions that have been coming in from members of our community and patients and so forth. So today what I want to talk about is testing. That seems to be the number one question where there is maybe a lack of clarity or understanding about what does testing mean and who can be tested and how are results coming back and all of those kinds of things. So, and there have been changes since we started this whole pandemic process when that was announced with regards to who could be tested, where they can be tested, where we send our tests, and all of the steps in that process. So I'm going to just start with today because it doesn't really matter what happened before. These are sort of the requirements that we abide by today, if you will. So today is a very limited number of people who can actually be tested. And it includes those people who are critically ill and in the hospital, any very ill people who are residing in a nursing home, or a healthcare worker or a family member of a healthcare worker, and recently added was also daycare providers. And that's the end of the list. And the reason behind all of that, or the reason for the really tight restrictions and the number of people who can even be tested, is a lack of resources relative to the swabs that are used to collect a sample, as well as in the labs that are doing these tests across the nation, shortages with reagents to actually conduct the tests. So we have been, up to this time, any of the samples that we've been collecting, and we have been collecting samples and sending them in, we have been sending those to the Minnesota Department of Health for testing, and then they do the tests and return the results back to us. Just recently, probably in the last week or so, we started sending our samples over to the Mayo laboratories, Mayo Clinical Laboratories, which has been a nice, I think a nice addition because our turnaround time for tests has been greatly improved. The Minnesota Department of Health has a pretty small lab, so they were getting backlogged on their test results. So now we get them back, fairly frequently. I think you've probably seen where when this lab opened up, they were, are able to do quite a few tests, up to even 4,000 a day. That doesn't mean they're running necessarily 4,000 a day. It's the capacity that their equipment can run, but the limiting factor on that is still going to be the reagents that are needed to be able to run these tests. So the fact that they could expand the number of tests being run didn't change the criteria. The state continues with that criteria, and those laboratories are also continuing with that same criteria. So if you were somebody who has symptoms, for example, in the community, and you want to be tested and you come in and you request to be tested, you will be told no, because you won't, if you don't meet those criteria, you'll be told no, we can't do that test. Even if we did collect a sample from you, the labs would not accept it. So we just want to be clear, because I think it's frustrating. We understand that. I think we're all frustrated with that. We'd like to do a lot more testing. I think that would help all of us have a little bit more peace of mind in terms of, is it in our community? How much of it is in our community? Do we have that community spread? Those kinds of things. And I think, from a patient perspective, just knowing that you test positive or not for that might just be one more piece of information that, gives you at least some comfort of knowing, an answer. But this is where, we all sit, today is there are not enough testing swabs, which we call test kits, and that's, what is used to collect the sample. Our role here as the healthcare provider is to collect the sample, and then we package that up and we send it over to the lab facility. Then again, that would be Mayo Laboratories in Rochester, where we're sending those. And then they run the tests and get those results back to us. So we appreciate everybody's, patience with that. The minute, we would have any more tests, test kits to collect samples, we would absolutely be doing that if the criteria were broadened or released a little bit more for more decision making on the part of the local healthcare organization to do that. But those are the rules that are pretty strict and in place right now that we just have to abide by. So, if you again have any questions about yourself, if you have symptoms, if you just want to talk to somebody about that, a couple of things for you. We still have the urgent care you're welcome to come into if you feel that your symptoms are pretty severe and you need to see somebody. You can absolutely come into urgent care. We ask if your symptoms are maybe not so severe, you stay at home, and you can use our nurse call line. We just started that last week, and we've gotten a lot of calls on our nurse call line, but it gives you somebody to talk to directly. That number is 457-7619. And that nurse will talk you through, your symptoms, provide some guidance for you, whether that's staying home or, potentially to come in and see somebody. But at least it's, one more avenue for you to talk to somebody. You're also welcome to go on our website, and we have a smart exam screening tool out there. Actually, this week, I believe around Wednesday, we should have a free screening tool that's out there, but within the smart exam itself, you can also do, one of those modules, the upper respiratory infection, and that will actually give you some guidance too, with some of those types of symptoms. I did want to just share, because I don't think we've put this out there. I know that we've had a number of people use our smart exam up to this point, and that's set up right now as a kind of a cash service. But with insurance companies being willing to cover 100% of the testing or the screening that goes on for patients for the coronavirus, we're actually going to go back and refund the folks who came in or used the smart exam for the coronavirus screening. And that'll get billed to insurance instead. So you don't have to do anything if you were one of those people. That'll just be refunded back to you and sent over to the insurance, for that payment instead. But anyway, you're welcome to call, again, that nurse line. You're welcome to use the smart exam. I think most people know or have heard out there, and it's an accurate statement, that 85% of people who might have that coronavirus, you're going to stay at home and you're going to take care of yourself. You're, going to do it as if, you had another type of illness that didn't require any type of other medical care. There isn't a specific treatment. There isn't a vaccine, there isn't, much else that can be done except for taking care of yourself at home. Maybe isolating yourself from other members of your family. And kind of keeping some of that separation in place would be really helpful also, just to, kind of contain that spread. But this is going to be one of those where you're just going to need to take care of yourself, until your body sort of works through that healing process, for all of this. So just wanted to, address this testing issue and these questions, because we know there's been a lot of confusion when we hear that, labs can do thousands of tests and yet we're not running more tests. And there's capacity to do that, but then there's the supply issue that is the limiting factor. So we wanted to clarify that particular issue for everybody, and hopefully, this kind of brief explanation helps in that regard. So, we're here to help you out in any way that we can. Again, if you're not feeling well, if you're getting, if you have the symptoms and you have your shortness of breath, if that gets exacerbated, if that gets worse, that's when you want to really come in, and we're here to take care of you. So we absolutely appreciate everything, the support that we've got from the community, but I want you to know that this, everybody here at Winona Health is here to support you and to help you. So with that, we're going to end this one, and we'll cover some other questions and some other video chats. So thank you so much.